A mini tummy tuck often is defined by an incision that matches or is very similar to a previous C-section scar. It's really too short of an incision to remove any kind of skin looseness. It can be used, though, to repair an isolated, simple separation of the lower abdominal muscles. The separation between those muscles can be repaired through a relatively small incision. But it doesn't afford us an opportunity to remove any amount of loose skin, because with removing skin, there must be a natural tapering of the edges. Otherwise, an obvious fullness will occur on the edges of that scar that looks very unnatural. A mini tummy tuck in the classic sense is, I almost never use that procedure because there are very few patients I see that have a condition that is isolated to the lower abdominal muscles. There is a procedure that I do called a modified tummy tuck, that I incorporate all the same elements of the true form tummy tuck, but I can do it through a shorter incision. And the kind of patient that is a candidate for that particular procedure is one in which has very limited loose skin, limited to the lower abdomen, with none really in the upper abdomen, but who also has the weakness of the abdominal wall between the abdominal muscles that we commonly see. In that scenario, I can create a very nice true form tummy tuck with a shorter incision, because I can still remove some loose skin, usually somewhere between 2 and 3 inches in diameter of loose skin, and neatly taper it so that it is not obvious. What I often see, unfortunately, are situations where a woman comes in, a patient comes in, who's had a tummy tuck, and it was a so-called mini tummy tuck, which was an attempt was made to remove some loose skin through a very short incision, and perhaps a muscle wall repair was done. There is this disharmony that occurs between the upper abdomen and the lower abdomen. That is, there is a profound fullness of the upper abdomen and an excessive flattening of the lower abdomen, creating a very unusual, unnatural appearance. And it was really the wrong procedure for the wrong person. I think it's very important for us to identify the condition that exists. Is the muscle wall weak? Is it weak on the upper abdomen? Is it weak on the lower abdomen? Is it weak on the upper and lower abdomen? Is there loose skin? Is there loose skin on the upper abdomen? Is there loose skin on the lower abdomen? Is there loose skin on both the upper and the lower abdomen? And then select the procedure. I would rather analyze the condition before commit to one procedure over another. Because ultimately, the goal of the procedure is to create a very nice and natural, attractive abdomen that has the elements that I just described. And sometimes we can incorporate liposuction into that scenario if we're doing a lesser procedure, the modified approach. It really requires careful thought. It requires a careful analysis of the condition and whether that condition merits a more complete incision line, a longer incision line, or the shortened one.